Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
When you would see a podiatrist, I think it's always better to see a specialist. I'm a specialist. I like to go to the specialist to see what's going on, and I think we're better treating it, and we're faster at treating it. So that's what I would recommend. I'd go, if you have a problem with your foot, come see me, and we can figure it out. If we can't, we'll find out what's going on and get you to the right person. We do see a lot of diabetics, and it is important that diabetics do come in, and it can range from routine trimming of nails and calluses, which is the diabetics are at risk, obviously, for neuropathy and peripheral vascular disease, and they're at risk for infections, and that's why so many of them can lose their leg or their limb. So really my job is, I feel like, a big responsibility when they come in. We want to keep your feet as long as you can. I don't want you to lose a foot. If you happen to lose a leg, your life expectancy really goes down. There's some studies out that if you have a major amputation, that your 5-year survival rate is about 50%. So it's really important to keep people walking. You can imagine when you walk now, it's pretty easy to walk, but if you lose a leg, you walk on one leg. A lot more energy. The heart has to work harder, so it just creates a lot more complications. You know, the other issue is when the diabetic gets the ulceration, and that's something that we want to treat, either debridements, making sure their vascular status is good, offloading them, patting them, surgery if we need it. If we have a bone that's really pushing down, I got a case tomorrow. I got a patient who is coming in with a bone that's very prominent and causing an ulceration, and we're going to remove that bone. Certainly, we also, the more serious people who get infections in the foot, when any patient gets a bacteria in their bone, it's kind of like a cancer. It just kind of eats and eats, and you can try antibiotics. It works some of the time, but really the definitive treatment is surgery to remove that. And we hope it's just removing the bone. Sometimes it is removing more, but that's what we want to prevent. That's what we want the diabetic to come in early before problems arise. I tell my diabetic patients, come in, even if it's minor. I want you to come in because I'd rather it be something simple than too late. You know, people tell me, how do I keep circulation on my feet? And I'd say, basically, that's everything you can do for your heart. You know, eating right, you know, watching your cholesterol, watching your high blood pressure. So the better you treat yourself with your heart and just common sense health-wise, you're going to have better circulation for your feet. Just wearing corrective shoes. If you are getting foot pain, come in. Maybe there's an insert we can do. You know, maybe something simple right away we can treat. Maybe if you're a runner and we need to balance you off a little bit when you run, and you know, to help prevent tendonitis and things. That's good. We can do that too. You know, I like the old quote. You know, when your feet hurt, you hurt all over, and it's true, because you can't. If your feet hurt, you can't do anything fun. I mean. And so I think that's, if we keep the feet, and the whole thing goes back to diabetic, the longer we keep the legs, the healthier we keep you. If you lose a leg, you can't really work out as well. I mean, you can't take care of yourself as well. You may need help with another caregiver or a ramp and all that. So yeah, the longer we keep your feet, the better off it is for your health.
For more information, visit us online at conwaymedicalcenter.com.